What are the signs and symptoms, and at what age does cystic fibrosis normally present itself?
Okay, as I said, there are major defect is in the formation of chloride channel, so it doesn't function well, and that's why there is a thick viscid secretion. So what happens if there is a thick secretion in the respiratory tract, that is, you can say in a layman term, phlegm, that cause choking of the airways, and that result in the increased bacterial colonization, mucosal inflammation, and mucosal hypertrophy. That result in a recurrent lower respiratory tract infection or pneumonia, ultimately resulting in a damage to the lung, and in medical term it is called bronchiectasis. So this form of illness may manifest in the first few months of life. And the other thing is thick viscid secretion in pancreas. So blockage of the pancreatic duct leads to blockage of this juice coming to the intestine, and that leads to a pancreatic insufficiency, and that will lead to a poor digestion of food. It may manifest even when the baby is in utero or during pregnancy, and that may manifest at birth in form of meconium peritonitis, in which the patient may not pass stool. Generally, a newborn should pass a stool within 24 hours. But if a child is passing beyond 24 hours, then one of the reasons may be cystic fibrosis. Subsequently, during childhood, preschool, and school going, there may be statoria, or you can say that fatty stool, that is in form of a large, foul-smelling, bulky stool. And because the child is not able to digest the food, the child is not growing well. Same thing happens to the sweat glands, and because of the increased chloride and sodium content in the sweat, if a child, the parents may notice that it is a salty kiss, though it is not commonly observed by the parents, but it may happen. In older children, it can be in form of during summer months, when the sweat dries up over the other parts of the body, including face, you may be able to find some salty crystals of salt on the area where the sweat has dried up. And during summer months, there may be dehydration, and the child in the beginning, around 3-4 years of age, may have a salt craving. So, as you had seen, that it may manifest in utero or during pregnancy. So, in the first 2 years of life, the common manifestations of cystic fibrosis are delayed passage of meconium at birth, may not pass stool at all, and that is called meconium ileus or meconium peritonitis. It is because the thick meconium or thick fecal matter, which is digested by the pancreas, blocks the intestine, and that ruptures in utero. Then, after birth, there may be obstructive jaundice, there may be low protein, or in medical term, we say hypoproteinemia. Some children may have anemia, and it may affect the liver also at birth, leading to a bleeding disorder. And as the age advances, there is a fatty malabsorption, in which the child presents with large, foul-smelling, bulky stool, and in first 2 to 3 years of age, there may be prolapse of a rectum. That is, the part of the rectum comes out. Initially, it goes back spontaneously. Subsequently, parents or mother may have to push it back, and that is because of the decreased support to the rectum. Then the children may present with bronchitis, bronchiolitis, and recurrent pneumonia. Between 2 to 12 years of age, it is predominantly clinical symptoms include malabsorption, recurrent pneumonia, nasal polyposis that manifest as a nasal blockage, and in some children, there may be intestinal obstruction due to intussusception. And children beyond 13 years of age, there may be chronic pulmonary disease in form of a persistent cough, expectoration. There may be clubbing, which is indicative of a advanced lung damage. There may be abnormal glucose tolerance test because of the endocrine function of pancreas, but that happens after 10 years of age. And if it is a frank diabetes, then it is cystic fibrosis related diabetes. Then sometimes there may be chronic intestinal obstruction due to plugging of the intestine by the fecal matter. There may be effect on the liver as age advances, and it manifests in form of a focal biliary cirrhosis, portal hypertension. Some children, small proportion, may develop gallstone, and almost 98% of the adolescent boys may have absence of sperm, that is we call azoospermia. The other atypical clinical manifestation is important to understand specifically in Indian children is because of the delayed diagnosis. We do not expect that they are diagnosed in the neonatal period, and because of the adverse or severe environmental issues, very high temperature in some part of the country, there may be significant electrolyte abnormality in form of a low potassium, low sodium, and there may be alkalosis. And in medical term, we call them a pseudo-Bartter syndrome, in which there is a hypokalemic metabolic alkalosis. There may be, because of the low potassium during the summer months, the intestinal motility is reduced, and it is called meconium ileus equivalent, which may present like a intestinal obstruction. Majority of the children, by the time they are diagnosed, they may be colonized with pseudomonas, which is one of the important bacteria which sooner or later comes in the airway or respiratory passage, and that is responsible for chronicity of the illness. Some of the children may have a deficiency of vitamin like A, D, E, K. These are called fat soluble vitamin. Majority of children in India may have a low bone mineral density, and there is a high incidence of allergic bronchopulmonary aspergillosis. Some of them may be deficient in zinc, iron, and B12 at the time of diagnosis. And as I said, there may be increased chances of diabetes once they are more than 10 years of age. And almost 2/3 of the patient may develop depression once they are more than 15 years of age. So long-term complications or clinical features of cystic fibrosis are CF-related diabetes, CF-related liver disease, pulmonary hypertension as indicated by breathlessness on exertion, hypertrophic pulmonary osteoarthropathy, decreased bone mineral density, and depression.